This is NDTV. And you're watching NDTV 24/7.
Hello and welcome to our special coronavirus show. I'm Gargi Rawat. We now know that the battle with COVID-19 will not end in a hurry. India too has seen the highs and cases every single day as the country lockdown was exceeded even further and further. People are going back to work, resuming other activities. In fact, everyone is trying to adjust with this new normal. In this show, we will take a closer look on how we live with COVID, including how to get medical help when it's needed. The people who are most vital in the battle to defeat COVID are the doctors, nurses, surgeons, paramedics and chemists. And yet we're at this situation where people are actually stigmatizing these very heroes or avoiding going to them for fear of infection. On this show, we take a moment to appreciate the contribution of the frontline medical professionals and how they are making access to medicines and consultations safer for you. And also we'll be going across to medical professionals for all the latest advice that they can give us against coronavirus becomes a protracted one. Joining me on the show is Dr. Ajoy Kumar Tiwari, Director of the Jai Clinic and Diabetes Care Center in Lucknow. Thank you for being with us. Also with me is Dr. Abhishek Shrivastava, consultant and endocrinologist with R&R Hormone Clinic in Jabalpur. Thank you very much, both doctors, for being on the show with us this morning. Now, Dr. Shrivastava, I'm going to start with you. We're at a time when many people are now reopening clinics, restarting consultations, and yet we see many people are hesitant to reach out for medical help or even step out of their homes, particularly to go to for any sort of medical care facilities because they fear the risk of infection. What would you like to say to that?
I would like to thank NDTV for inviting me on this important topic. And yes, indeed, the times are a bit difficult right now for us, for general public. There are certain pandemic situations which all of us have not seen before. And there are certain conditions, psychological stress, bound to occur to general public, situations of anxiety, situations of depression, the general public will face. But I would like to say that no need to get panicky right now because we are observing a good recovery rate in India as well as all over the world. As far as visiting OPDs, visiting to a doctor in a hospital, in a nursing home is concerned, until and unless it is very necessary for you to visit a doctor, don't visit anywhere. Stay at home, stay safe, stay healthy. Follow all the protocols which are being told to you. And even after all that, even after all the precautions, if you are bound to visit to a doctor, I want to say that we as a doctor are taking all the proper measures which would look after the safeguard of the patients. We are maintaining social distancing, we are hygiening our clinics every day, each and every day. Sanitization is occurring every day. We are sanitizing all the equipments, we are sanitizing all the OPD cabins every day. So no need to get panicky about that. Visit to a doctor only when it is very much necessary for you to visit.
All right, now bringing in Dr. Tiwari as well. Dr. Tiwari, a lot of people are still worried when they go to the doctor for consultation that they may be exposing themselves to infection. Also for the doctors, there's very little way of knowing whether an asymptomatic patient is being checked by you or not. What do you do in a situation like that?
Okay, actually the entire scenario has changed for now because we have to be very careful and the first and foremost thing that we are taught as a medical student is that we have to put in the patient. So we have to follow precautions at our place. We have created triage. We are monitoring patients prior to emptying our numbers. We are going for thermal scanning for all of our patients, and we are maintaining all the records regarding the temperature, phone numbers, and the addresses of our patients. We have got sanitation depots all across the clinic, be it the reception, be it the entrance, be it the doctor's chamber. And secondly, we are trying to teach our patients few things. Firstly, we are telling them that if it is possible, go for a video consultation or a teleconsultation. And if it is a pressing need, then do come to the clinic. But first, write all the points that you want to discuss with your patient. Don't bring attendants.
and children are absolutely no, and finish off the consultation quickly and don't lurk around and go away immediately. So these are the precautions that we are telling our patients.
All right, so let me ask you, between teleconsultancy and clinic consultancy, is there any difference? Would you prefer in clinic consultancy in certain cases, and what would those be?
Actually, teleconsultation hasn't picked up to that extent. But definitely, if a patient is a stable patient, is having a glucometer and is doing self-monitoring of blood glucose, and he otherwise is normal, then he can always go for it.
So, Dr. Tiwari, tell us, what precautions do you take when you're examining a patient?
Actually, when we are examining our patients, firstly, we are all wearing protective wears. We have designed our consultation place like that we are maintaining a distance of around 1 meter from our patients. And secondly, we are trying to interact with our patients telephonically prior to coming to the appointment, because all appointments are being taken on phone. So we are trying to get the symptoms quickly prior to their visit. Then we are using a computer for giving our prescriptions. So the amount of touch and all those things involved is very less. We are all wearing protective shields. We are wearing gloves. We are using sanitizers prior to and after seeing every patient.
And Dr. Shrivastava, let me ask you, it's not just the question of frequently changing your PPEs, changing gloves, changing masks for all of you. What about the disposal of the PPEs? Because those could also carry risk of infection.
Yes, PPE kits have become a part of daily lives of doctors or a nurse or a medical professional, lab technicians. So it is very important for us to dispose of all these PPE kits properly, because the chances of getting infection with these PPE kits are very high. So we as a doctor do take care of all these measures, precautions wherever it is required. When it is concerned with PPE kits, we daily sanitize our PPE kits with sodium hypochlorite, and then we dispose of in a separate bucket. Then when it's concerned with gloves, face mask, shoe covers, shields, everything, we also dispose them in a separate container. So PPE kits are kept in a separate container, masks, shields and gloves are kept in a separate container. We both sanitize these things with sodium hypochlorite, and daily we call the municipal corporation administration, we call the medical officer department to dispose of these waste products as soon as possible. So it is mandatory for us to dispose them properly on a daily basis manner, in coordination with the municipal corporation members, with the medical health officers and the hospital or the clinic staffs.
Now, I understand how important this is, Dr. Tiwari. You're the director of a clinic itself. Give us the sense of, what a patient would experience when he comes to the clinic. What kind of precautions are there for the staff at the registration desk, which the patient will be, where the patient would be the first point of contact? And what about the helpers who are in the OPD? What kind of sanitation and precautions are they taking? Who are the ones who are wearing the PPE kits while examining patients?
So, firstly, we have ensured that all our staff is wearing protective shields. They are wearing their aprons, and they are also wearing their gloves. And they have been told that they have to go for a minimum touching of the records of the patients, and they have to sanitize, give sanitization, alcoholic sanitizers to all patients prior to talking to them or prior to looking for the records. So that is what we are trying to do with them.
Also, Doctor, particularly with the elderly who need more consultations with doctors, need follow-up visits. Dr. Shrivastava, what is your advice for them? What precautions need to be taken if they don't have the options of telemedicine? They have to come in to the OPD for treatment. What would you tell them?
The situations are a bit tricky for elderly people, especially those who are suffering from chronic diseases like diabetes, blood pressure or thyroid diseases, and if they don't have any facilities of teleconsultation, then I would like to suggest them that visit to a doctor, visit to a OPD, but after taking proper measures. If you have your own vehicle, use your own vehicle, don't use public transports. And after coming to the OPDs or nursing homes or hospitals, wear mask, maintain social distancing, don't talk to the people surrounding surrounding yours in the OPDs or the clinics. Try to be as safe as possible, because the risk of getting the infection is much more higher in hospitals, in nursing homes and in the OPDs.
Now, Dr. Tiwari, let me ask you, for elderly people, they have to be even more careful and take precautions. But what about other patients? Not everyone has their own transport. Some will have to depend on buses, auto rickshaws and taxis to come to your clinic. So what kind of precautions should they be following when they come to the clinic and after they return?
First and foremost thing, the best protection against COVID is social distancing. So that is of paramount importance. So even I think in all government buses or any transport that is being offered, everyone is trying to follow the rules, and wearing a mask, and wearing the mask properly is also very important, that you should cover both the nose as well as the face. And secondly, you should always carry a sanitizer with you, portable sanitizer with you. Wherever you go, if you are touching any surface, you should always sanitize yourself after touching any other thing. So with little bit of care, proper social distancing, proper sanitization, and wearing proper mask, I think this is possible if it is unavoidable.
Now, doctor, what about your own care? Because at the end of the day, doctors are seeing patients. They're perhaps the most at risk. So what are the kind of precautions that you take, both as a medical professional and also a high-risk individual in that sense?
Yes, the conditions are a bit tricky, bit complicated for us, both as a doctor and as a human being. We have to maintain a proper balance between our professional and personal life, and that is a bit difficult for us because we have to take care of our family members, we have to take care of our staffs, as well as we have to take care of our patients also. So basically we try to balance all these situations in our life. We do take some extra proper measures to sanitize ourselves, to maintain hygiene conditions within ourselves. We do take care of our family members a bit extra. We tell them to maintain hygienic conditions, to sanitize the house, to sanitize the equipments, to sanitize the utensils which they use daily in their routine life. So basically we as a doctor try to be over active when it is concerned with our families in a personal life as well as professional life also. So bit difficult for us, but we try to manage as far as possible to keep things at part or at bay.
All right, can imagine it's very challenging for all the doctors out there. Well, we'll slip into a short break now. We have talked at length about how to make a visit to a clinic, visit doctor and other medical professionals, and we'll take a break. But when we come back, we'll also take a look at other aspects in the battle against COVID. It's been several months now that we have been dealing with this pandemic. Is the fight against the virus now easier? We'll discuss that after the break.
Knowledge Partner, USV, your reliable healthcare partner.
Amity University has India's largest scholarship program, from which over 25,000 brilliant students have already benefited. Students with over 93% in Class 12 boards get 100% scholarship, and students with over 90% get 50% scholarship. Join brilliant, like-minded students who want to be successful. Apply at amity.edu/scholarships. Thankfully, green laminates are antibacterial.
अब पढ़ने के लिए नया कंप्यूटर भी मिलेगा और डोसे के लिए नया पैन भी, क्योंकि अपनी दुकान में मिलेंगे आपकी जरूरतों के सारे सामान पूरी हिफाजत के साथ। बताइए क्या चाहिए? Amazon, आपकी अपनी दुकान।
Dil Se Seva, feeding millions. For details on how to contribute via online banking or via QR code, log on to ndtv.com/dilseseva. With your contributions, the Langars can continue providing hot meals to everyone.
Namaskar, this is Amitabh Bachchan. The joy of holding a healthy baby, the smile of a mother looking into the face of a child for the very first time, the first steps a child takes, her smile, the first word she speaks. These are the simple and profound joys of the first 1,000 days. If she and her mother don't get the care and nutrition they deserve, none of that will be possible. The first 1,000 days, remember, that will define a lifetime of wellness. Come and join us on our journey to ensure a clean and healthy India. An India where our most vulnerable get the best opportunities to become our strongest. Banega Swasth India.
9 to 5 job, अरे 5 to 9 job, भाग दौड़ all the time job. The roaming वाला job, the deadline वाला job, or are you living in the market वाला job?
Life is full of options. Choose a job and earn on your own terms. Choose to become an LIC agent. It's more than a job. It's career insurance. Be your own boss. Be an LIC agent. अब life set है.
मुल्तानी कोका, कफ सिरप, तुलसी, वसा, यस्ती मधु, पिपली के गुणों से भरपूर, जो खांसी पर करे तुरंत असर, ताकि बदलते मौसम के साथ आप न बदलें।
The bold new Datsun Ready Go. Price starts at rupees 2.83 lakhs. Test drive today.
NDTV और दिल्ली सिख गुरुद्वारा मैनेजमेंट कमेटी ने मिलकर एक कैंपेन शुरू किया है, दिल से सेवा, which focuses on the great Sikh tradition of langar, which is also known as community kitchen. जगह जगह गुरुद्वारों के दरवाजे खोल दिए गए हैं। रोज हजारों लाखों लोगों को लंगर खिलाया जा रहा है, भूखे लोगों तक खाना पहुंचाया जा रहा है। आई वुड रिक्वेस्ट, मैं आप सभी से प्रार्थना करूंगा कि आप इस कैंपेन में बढ़ चढ़ कर भाग लें, क्योंकि इस वक्त हमें एक दूसरे की जरूरत है।
Thankfully, green laminates are antibacterial.
ये मेरी जिम्मेदारी है कि मेरा घर कोरोना से सुरक्षित रहे, और इसमें हमारे साथ है माइक्रोटेक का ये इंफ्रारेड थर्मोमीटर, हर घर का सुरक्षा गार्ड।
तो हर गृहिणी को चाहिए माइक्रोटेक का नॉन कॉन्टैक्ट इंफ्रारेड थर्मोमीटर, लॉन्ग रेंज स्ट्रॉन्ग सेंसर और वारंटी के साथ, CE and ROHS certified.
The Sikh tradition of langar is about ensuring food for the hungry. No matter who you are welcome with open arms at the Guru ka langar.
इन्होंने शुक्रगुजार है मालिक का, जो इन्होंने इतना साथ दिए।
लंगर का मैं वाहिगुरु का प्रसाद है,
डेली बांट रहे हैं। इनकी मेहरबानी, भगवान भला करे इनको।
Watch a special show on how the Gurudwaras have fed over 1.5 crore people during the pandemic. Dil Se Seva, feeding millions, Saturday at 11:30 a.m. and Sunday at 7:30 p.m. only on NDTV 24/7.
The added value that we're bringing to the Bihar state response is the provision of oxygenated beds for moderate cases of COVID. So what we've seen across India is that there is what we call an oxygen gap, where the availability of oxygenated beds is quite less. Don't forget that apart from the physical effects of COVID, COVID also has tremendous stigma and discrimination, particularly for healthcare workers. Many of them who are away from their families, working long hours, no support mechanisms exist, etc. So something that we want to do is provide mental health support to healthcare workers and other frontline workers like Ashas, Anganwadi workers, etc. going forward. We also have a new helpline that's starting now, and that is available to healthcare workers and their families, etc.
Welcome back to the Corona Special Show, where we talk to medical experts about how to live with COVID-19. What do we do now that we've realized that this is the new normal, as this is going to be a protracted battle against the disease? Well, we have with us Dr. Abhishek Shrivastava and Dr. Ajoy Kumar Tiwari. Let me now ask you, Dr. Shrivastava, there are so many people who are now getting back to work, to their offices, to their various workplaces. What is your advice, particularly to those who are handling a lot of things that other people consume, shop owners, vegetable vendors, hospital staff? What precautions would you suggest that they take to firstly avoid getting the disease themselves and then passing it on to other people?
See, the life before COVID and after COVID has changed dramatically, and it has changed for every one of us, be it the restaurant owners, be it the retail shop owners, be it the vegetable vendors, be it the fruit vendors, everyone. Life has changed for everyone. And in the recent times, during this COVID pandemic conditions, you have to take proper care of yourselves as well as other people, those who are coming to you. And my advice for the people, those who are running restaurants, is to do not overcrowd your restaurants at all. Do maintain proper distancing between the families or the people, those who are coming to you. Do sanitize your restaurants thrice a day, 4 times a day. Do keep hand sanitizers with yourselves, and do try to maintain proper hygiene conditions while preparing foods, while preparing snacks for the peoples. And then the advice to the retail shop owners, those who are selling the retail products, my advice is to keep proper distancing between the people, those who are coming to you to buy something else, wear proper mask, and do not allow people to come to you, those who don't wear mask. Because see, mask is the most important thing in recent times. If any person or if any people who is coming to you without wearing a mask, do not allow them to buy anything from your shop. Tell them, educate them, teach them to wear a mask, to keep hand sanitizers with yourselves, to maintain social distancing, and come to the shop only when it is necessary. To buy small things, it is useless to go to shop all the times, 10 times a day, 5 times a day. It is useless. So my advice to the fruit vendors also, or the vegetable vendors, those who are going to various houses or the streets to sell the vegetables or the fruits, to wear masks. Do not overcrowd people's near you. Try to keep distance as far as possible. Wear gloves wherever it is possible. And once again, try to tell general public to wear mask all the time.
All right. Well, Dr. Tiwari, let me ask you also about this. So the problem is many people are going back to offices. There are shared workspaces. In some offices, there's no physical barriers between tables or workspaces. Some offices have central air conditioning, and that's also been flagged as a problem. So how do we implement this kind of social distancing within the office? It's not always possible to have walls or barriers or cabins between the desks. So then what precautions can they take?
Okay, I think many of the offices are going for shift works, so they are working with half of their employees. And secondly, as Dr. Shrivastava said, that wearing a mask, wearing a shield, face shield, wearing gloves, and maintaining distance. And the first thing that I want to say is that the perception amongst the people is that once the lockdown is over, it means that this is the end of everything. So we have to be very careful. The disease is there and the disease is increasing every day. So we have to be very careful. We have to wear gloves. We have to wear shields. We have to use sanitization. We have to discard our clothes after coming back from our offices and take a bath quickly after coming from the office. So these all precautions are to be followed. We have to work because we have to work. But it is not that as the old times. So social distancing is the new norm, and that has to be followed in word as well as in practice.
All right, that's a very important point that you've made. Thank you very much indeed, both of you, for joining us on the show today and all your expert advice. We hope that all of you watching will benefit from all the advice that both the doctors gave to us. Thanks so much for watching. Goodbye.